Hi, I'm Katie, and I lead our Client Solutions team at Cedar. Cedar's Client Solutions team is focused on three things: predominantly patient success, product success, and our business operations. Our goal at Cedar is really to be able to deliver a standout patient billing experience, and we believe that it pays to care. We partner with our clients in a consultative approach to make sure that they're able to make the most out of their partnership with Cedar, and that really kicks off with a solid business implementation. The responsibility of a vendor during an implementation process is to make sure that it is as seamless as possible for the health system or the provider that we're working with. And so that means that we do everything we can to make sure business happens per usual from the provider side. In order to make sure that our implementations are as seamless and non-disruptive as possible to clients, we always start with a client kickoff meeting where we're laying out client expectations and Cedar expectations for that implementation up front. And from those clear expectations up front, we then launch into discrete work streams and really getting to know a client. So we make sure that we're mapping Cedar's workflows to the client in a way that is as least disruptive to the client's business practices as possible. We work with clients to create customized implementation plans. We start with more standard processes around build and making sure that our product meets the client's needs. We ultimately then move into a testing phase with clients to make sure that we're ready for go live, and then that culminates in a go live or a launch with that client. COVID-19 has meant that we've brought all of our implementations into a remote setting. So instead of meeting with clients face-to-face, we use Zoom and meet by video instead. What we found actually is that this still enables us to execute our implementations well. Between 2019 and 2020, we've actually reduced the timeline of our implementations while increasing our implementation number by about 300%. So we found that shifting to this remote environment has actually enabled us to continue our implementation growth and continue to scale. At Cedar, Go Live is really the beginning of a client relationship. From that point of go live, the client relationship is led by our client growth team to ensure ultimate accountability of Cedar, as well as our product success team. So whenever a client has a question during a relationship with Cedar, they have a touch point to be able to ask that same day. For provider staff, their experience with Cedar really starts upon go live. Prior to that experience, our provider staff are trained to use the Cedar platform, and it's very user-friendly. So oftentimes with that training and then their experience working with the Cedar platform, they're able to navigate and support patients effectively. That said, if they have questions or comments as they go, feedback on Cedar, they're always able to write into our product success team, and the product success team is ready to help them that same day. Healthcare organizations have benefited from improving the patient financial experience in a few different ways. First, it helps increase bill resolution, but also helps increase patient loyalty. We found that patients overall have high expectations for digital engagement with their healthcare providers, on par with their experiences across their consumer lives. With Cedar, those patients are able to have a really standout billing experience and seamlessly resolve their bills through multiple different ways that meet the patient where they are. Whether that's a one-time payment, setting up a payment plan, or paying partially, we help patients make those payments in a way that fits their lifestyle and makes their experience with that healthcare provider a really solid one.